Hi everyone, this video goes with the integumentary system. So we're going to look at the structure and function of our largest organ and look at some of its functions of protection, sensing, and even signaling health issues. The topics that are covered in this video include the cells that are found in the epidermis, the functions of the skin color and diagnosis, skin cancer, and burns. The outermost layer of the skin is the epidermis, and it's made out of several specialized cells. They include keratinocytes, which are the most abundant cells in the epidermis. They produce keratin, which is a fibrous, waxy protein that helps protect the skin from physical and environmental damage. We also have melanocytes that produce melanin, and that's the pigment that's responsible for skin color. Melanin also helps protect us from UV damage. There are dendritic cells. They sometimes are called Langerhans cells, and they're part of the immune system, so they help us fight off pathogens. And then tactile cells, or Merkel cells, are associated with nerve endings, and they're part of our sense of touch. So we think of the skin as just a barrier, but it actually has many vital functions. Its number one function is definitely for protection. It forms a chemical barrier, physical barrier, and biological barrier, protecting us from the outside world. The chemical barrier is made of sweat and oil that's found on the skin, creating an acidic environment that we call the acid mantle. Bacteria don't grow well in acidic environments, so it inhibits bacterial growth. Physical barriers are the structure of the skin and the keratin layer that prevents water loss and prevents liquids from entering our body. And then there are biological barriers. The immune cells that we were just talking about, those dendritic cells, dermal macrophages, which are another type of immune cell that offer biological defense. Temperature regulation is another function of skin through sweat production, blood vessels, and the little muscles on our hair that's found throughout our skin all help regulate temperature. Sensation is really important. So the skin has many sensory receptors that detect pressure, temperature, and pain. Whenever I talk about sensation, I like to talk about how important it is that we feel human touch, right? Babies without human touch fail to thrive, which means that they stop growing, right? And they can actually die from lack of interaction. And as we get older, we get less touch. And you'll see if you go into health fields that your patients that have more contact, more physical contact, tend to be healthier or recover better than people who have less contact. So it's an important thing to think about. Your skin has a metabolic function in that it helps synthesize vitamin D. We need to be exposed to UV light in order to synthesize that vitamin D. So during the winter, some of us get a little low on our vitamin D. Vitamin D is essential for us to be able to actually absorb calcium in our body. Skin is also a blood reservoir. At any given moment, up to 5% of the blood in your body is in the skin, and it can be redirected if it's needed. And then it excretes things, right? So it can excrete small amounts of nitrogenous waste through sweat, some amounts of oxygen, some medications get secreted through our skin. Now, people's skin color can tell us a lot about someone's health, but I want to make you take a moment and think about the fact that everybody has different skin color. And so because of that different skin color, underlying conditions may look different in people with darker or lighter skin. And there's definitely a bias in medical books and A&P books towards showing lighter skin. And so just kind of be aware of that. There are some resources. There's an Instagram account called Black Skin Matters. There's a medical doctor who recently released a book on skin color diagnosis in different skin colors. So it's really important as a nurse, a doctor, whatever capacity that you're working in healthcare, that you are aware of that bias, because you might miss kind of a blue tint to somebody's fingernails or somebody's mucous membranes if you're not looking for it. So speaking of that blue tint, that's called cyanosis. Cyanosis happens because when oxygen levels get low in the blood, the hemoglobin takes on a bluish tint. It doesn't become fully blue, but it's a reddish blue that we can see through our skin, particularly in the areas that have capillaries right at the surface. Arrhythmia is redness, so we get red with fever, inflammation, sometimes high blood pressure. Pallor is pale skin, so you might get pallor with anemia or low blood pressure. Again, people who have darker skin, you want to look inside their mouths or in the mucous membrane surrounding their eye, so you can kind of get an understanding if they are pale. Jaundice is a yellow skin tone that's related to liver disorders. You might see somebody with very bronze skin, and that is a sign of Addison's disease, which is involved with the adrenal glands. And then bruising. Bruising happens when you have blood that gets trapped underneath the skin and it clots. And so, bruises go through a wide variety of colors as they're healing, and that's really just breaking down the components of blood. Our last topics in this chapter look at the kind of common medical conditions that we see involving skin. So skin cancer is a very common problem for people to have. Many of us have bumps and lumps on our skin, and they're benign, right? So benign means not cancerous. But some of them are cancerous, okay? And the number one risk factor for skin cancer is how much time you've spent with UV radiation, and chronic skin irritation also plays a role. There's three major types. Basal cell carcinoma, which we see over in the upper left, is the most common and the least dangerous, okay? It starts in the stratum basale, and it grows very slowly. It's treatable with surgical removal, and that's usually all you need. Over on the right-hand side, we have squamous cell carcinoma. It involves the keratinocytes that are found in the stratum spinosum. It's usually red, scaly patches, often found on the ears, the scalp, and the nose. It can spread, but it has generally a good prognosis with treatment, usually surgical removal. Melanoma is what we see on the bottom. Melanoma arises from from melanocytes. It says it in the name, and it's the most dangerous type. It spreads very quickly. It's pretty resistant to chemotherapy, so early detection is really important. And you'll see people talk about the ABCD rule or the ABCDE rule. So A is for asymmetry. So if something's symmetric, it's like a mirror image. We see that this melanoma at the bottom is definitely not symmetrical. We see that there's an irregular border that's common in melanoma. Different colors, you might see black, browns, reds, blues. The diameter is larger than 6 millimeters, so that's larger than a pencil eraser. And then evolving, they often change shape. And our last topic is burns. So with burns, we need to know how much of the skin was burned. So burns are classified by either partial thickness burns, which are first and second degree burns, and full thickness burns, which are third degree burns. When we're looking at a first degree burn, it only affects the epidermis. You're going to have some redness and pain, maybe a little swelling, but not much else. And there's really no treatment that we have to do. Just keep it clean, maybe cover it if you want, but it should heal in a few weeks. A second-degree burn damages the epidermis and the dermis. In second-degree burns, we have blisters because fluid kind of gets trapped between the epidermis and the dermis. And so the only real visual or symptomatic difference between a first and a second-degree burn are those blisters. And again, usually the only treatment is to keep it clean. If the blister pops, keep it covered, and be on the lookout for infection. A third-degree burn, or a full-thickness burn, destroys the entire skin layer. So it destroys the epidermis and the dermis. And so when you see a third-degree burn, it's sometimes white or cherry red or black. The nerve endings are destroyed, so it doesn't hurt, at least initially. Often people will have second, third, and first-degree burns, so they're in pain in some areas, but the worst, the areas that were burned the worst are often the least painful. For third-degree burns, we usually need skin grafts, and so skin grafts, will use skin from other parts of your body to form a new layer of skin where that burn has occurred, or a new layer of protection, really. When we're talking about burns, the biggest concern that we have is dehydration and electrolyte imbalances, because that epidermis, remember, has the keratin that keeps fluid in and keeps fluid from the outside out. Once that's gone, we have a lot of seepage. So if you see burns, there's going to be a lot of fluid in that area. And you can lose so much fluid that you end up with shock. And healthcare professionals will determine the amount of fluid loss by determining the amount of the body that's been covered by the burn. And so here this illustration shows us it's something called the rule of nines. So the head and neck are considered 9% of our body. Each arm is 9%. The groin is only considered 1%. Lower limbs are 18 inch each, so 9% on the front, 9% on the back. And then the trunk is 36%. The chest, 9%. The abdomen, 9%. The upper back, 9%. And the lower back, 9%. Okay. So that's just a way that healthcare professionals estimate the amount of the body that's been burned, and therefore how much fluid the person has likely lost. If you have over 25% of your body with second-degree burns or over 10% of your body with third-degree burns, that's a really critical situation. We need to replace fluids very carefully because we don't want to injure kidneys or the liver. Another really critical situation is when you have your hands, face, or feet burned. Those are areas where scar tissue is really uncomfortable and really limits the amount that you can use your hands, face, and feet. So those are really concerning situations. And treatment for these critical burns are IV fluids, antibiotics, wound cleaning, temporary coverings, and skin grafts. So I hope this video has helped you understand the main points of the integumentary system. Make sure you look at your notes and your focus outlines, because while I've covered a lot, I have not covered everything, but probably about 85% of what you need to know. I will look forward to seeing your questions on Canvas and hearing from you throughout the week.